To discover heart conditions, cardiologists need machines such as MRI scanners, which can be expensive and are not always available in every UK hospital. Ventripoint have developed an echocardiography technology that is affordable, mobile, and designed to deliver optimal treatment to patients more quickly than more conventional protocols.
Eight-year-old Nancy was born with pulmonary atresia. She underwent surgery at just a few days old and is still monitored regularly at the East Midlands Congenital Heart Centre at the Leicester Royal Infirmary. But here, her cardiologist uses technology that's a game-changer in cardiac care and allows him to transform a 2D echocardiogram into a 3D model of her heart within minutes, and with an accuracy comparable to an MRI.
It's non-invasive, which is a reassurance. Nancy did, when she was a baby, had to have an MRI, and it meant that she had to have some dye injected so that everything showed up on the MRI. It was quite a traumatic process. So yeah, I'm thankful that we don't have to go through that every time, because we do come back between every 6 to 9 months to get a picture of what's happening.
The VMS Plus technology uses a sensor attached to the ultrasound transducer to track its spatial coordinates and orientation. A separate sensor also tracks and corrects for any patient movement.
So breathe in and out, and stop breathing and breathe away.
The software then uses a patented algorithm called KBR, which stands for Knowledge-Based Reconstruction, to reference thousands of MRI scans and create a realistic 3D model of all 4 chambers of the heart, regardless of the quality of the images or the geometries of a patient's heart.
It's quite nice because you just got to wait till they call your name, and then when it happens, it's all fine and calm.
And this technology doesn't just improve the experience and outcomes for patients, it also empowers cardiologists to diagnose and make treatment decisions faster.
In Leicester, when we've been using this system, we're able to provide a much better follow-up for these families. It allows us to track the progression of these children who otherwise I think we would be using inferior methods of looking at what is a very complicated heart structure. And one of the really exciting things that I'm starting to explore is actually taking it around the hospital. And in particular, we're starting to use it for our most sick patients who are on the intensive care unit, who actually getting that information about how well the heart is functioning can really help us with deciding on what treatment they get and hopefully improving their outcomes.
You know, at the end of the day, Vic, it's really about the accuracy and the reliability of the results that they're obtaining and getting those results quickly.
And Ventripoint's CEO told me from Canada that as well as the technology being portable and cost-effective, it can also be attached to any ultrasound device in any setting. And it's especially useful for evaluating the right ventricle, which is hard to image with conventional ultrasound.
There are issues, especially with the most complex cases, being able to image the right side of the heart, for example, which afflicts congenital heart defects. If they're not able to get a perfect image with other tools that are out there, they're not able to get accurate results. That has been the vision and part of the mission for the company. It's about working with healthcare providers and institutions to provide better, simpler, smart tools for them to be able to add to their diagnostic capabilities.
VMS Plus is more than just technology, it's a vision for better cardiac care, one which supports cardiologists in their decision-making and improves the clinical experience for patients and their families.